This is Dr. Spiegel, and I'm here to kind of talk to you a little bit about things to do now that you've kind of been at home for about 6 weeks, and what kind of issues seem to crop up and how it affects potentially your immune system and just not feeling well. Number one, we're going to talk about sleep. It tends to happen when you're home like this is you get out of your normal routine. When you get out of normal routine, you're not going to sleep at the same time, and you may be waking up frequently in the middle of the night, or you're just, you're not waking up at the same time in the morning, you're not eating your meals at the same time. And your body basically wants to feel like it's on a regular routine, and when you get out of that, things tend to go awry. Sleep is really important for your immune system, so therefore we need to kind of address that. So my advice would be to make sure whatever pattern you're going to get in, stick with it. 11 o'clock at night, 12 o'clock at night, whatever it is, and then give yourself that 7 to 8 hours. If you're having a tough time falling asleep, supplements such as magnesium may help that. Another supplement such as L-Theanine may help that, to help you with sleep onset. If you really have a tough time with waking frequently in the middle of the night, I recommend a supplement called Melatonin. That's a sustained release, usually 1 to 3 milligrams at bedtime. Melatonin is also a really, really, really strong antioxidant. It's been used in lots of studies treating cancer patients, and the main reason there is its effect on the immune function. The other major issue is that most of us who are still working at home usually are working at a desk. And when you work at a desk for long periods of time and you don't get up, you develop kind of bad postural habits and postural faults, which are not so uncommon for those people working in an office setting. But usually when you get to the home setting, your ergonomics or your work design is not the same, and we start to get into trouble. The classic places that people get into trouble are usually neck and shoulder and their hip area. So the two muscles that you want to stretch on a regular basis, the muscles around your neck or the trapezius. And it's simple, basically turning your head from side to side, kind of like this, and pulling on your head is very good. And the other one is working on your hip flexors. Your hip flexors are typically stretched in a position with one knee on the floor, kind of like a lunge type maneuver, and you should feel the stretch in the groin region. The other key thing when you're sitting for long periods of time is to take frequent breaks. Some people can't do it as often as we like you to do it, but at least if you do it every hour to 2 hours, getting up and moving around, stretching, getting a little break, going to the bathroom, whatever you're going to do, at least so your body's not fixed in that same position. The third thing that you want to be able to do is to get outside and do something. It doesn't mean that you socially are amongst other people, but you don't have to kind of isolate in the home. What I'd like to see is some people just getting out and walking. Good 45-minute walk every day is good for the soul. It'll help you with your sleep, it'll help your digestion, help your immune system, all of which are good things. And if you seem like you just can't get out of your own way, we're here for you. We can help you deal with these aches and pains and make sure that you get back to your normal routine and be able to function in a normal way. I know how to use this, so if you get into trouble, we're doing the right thing. We're gloving and we're putting these N95 masks on to make sure everybody's safe. Thank you.